That's a traditional way to approach wellness. Then comprehensive, they at least make a speech. And then Champion Company got a vision. They had the vision. I won't go through the rest of them. But there's characteristics of every one of those strategies. Now, which of those companies you want to be in? You want to be a do-nothing company? That's fine. Just do nothing. Just pay for things. When costs go up by 10%, how do you match those costs? You can sell more product. You can get more efficient. You can shift costs to employees. You can ship jobs overseas, some of you. You can just drop benefits. That's all right. You made it this year. What about next year when it's going to go up another 10%? Can you do the same thing next year or the year after? So the do-nothing strategy is good if you're going to retire in 5 years or 3 years. What about the other people still going to be there? Do-nothing strategy is unsustainable. Here's the environment and the culture. You want to work in company A where you have the culture is from a very good company on the right to a very non-supportive environment or culture on the left, and the environment non-supportive and very supportive. You want to work in location A or location B. If you say you want to be in location B, and if we can prove it's good for your business, just like green has to prove that it's good for your business or you won't do it. You shouldn't do it. But if we can prove that being in that culture, high, very supportive culture and a very supportive environment, it's good for your business, how are you going to get from A to B? You got to move from here to there. That's where your health promotion people or your consultants have to help you do that. How do we do that? How do we move from A to B? And of course, you have to move the environment and you have to move the culture. It's probably easier to start with the environment than it is with the culture. Because culture is sort of what happens after when people go to work. Then we talk about engagement in the individual. They do health risk appraisals. They do biometric screening and coaching. They have a contact a health advocate or health coach. And then they have 2 other activities. That's an engagement. Participation often is just that. You may do something, but not a lot. But if you do all 4 of those, that's an engagement. You got to get 95% engagement. And by the way, on coaching, you don't wait for the coach to call you. Everyone has to call the coach first, or contact, not just call. I'm trying to stop saying call. Just contact the coach. Because you're responsible. And no incentive until you do all 4 of those. You could break it up if you want to. A lot of people are doing that. I say all 4, all or nothing. $1,000 if you do it all, 0 if you don't do it all. Whatever the right number is. Measurement scorecard. Engagement, 85 to 95% engagement. Percent low risk, 75 to 85% low risk. Those are the 2 fundamental issues that you need. Everything flows from those 2 things. Everything flows from engagement, company engagement. I just have employee engagement, company engagement first, employee engagement, and then percent low risk. Company engagement includes the environment. Those are the things that move the organization. Everything else is not. And proof of concept, if you really wanted to prove it was your program that did it, then you have to look at the change in risk levels beat the natural flow, and change in costs beat the natural flow for the same people and for the whole population in general. Year-over-year trends approach 0%. And improved or no change, you get separation of those that don't change versus those who did change and got better. The economics, the red line, this is the percent low risk. How many people are low risk in your organization? If you all started here, this is actual data. If you all start here at 2007 in this case, but year 1, if you do nothing, that's a do nothing, you go from 60% down. The lowest we've seen is 45% low risk. So it'll take you time. They'll be down to 45% if you do nothing. I don't think you go below 45. It's going to level off at that. You can't get any worse than that. So if you're at 45, you can't get any worse. So that doesn't mean you shouldn't do anything. And the champion companies, they'll go from 60 up to 75% low risk over time. And the other ones will go in between. Here are the economics of the projected healthcare costs. The champion company will get to zero trend very rapidly if you do it all, especially the senior leadership and operations leadership. And the zero trends, the do nothing will go up whatever it's been going up. All right, summary. I'm about done. I have enough time, Bobby, 5 more minutes? 5 minutes, okay. Everyone agree, 5 minutes? If you don't want to take 5 minutes, leave now. All right. This is a little new thing I haven't used before in this today. But each of you are on one of those, on that continuum someplace. Where do you want to be? Want to be sick? The good news is, if you're dead, nobody's over here. That's good news. I don't know about in the afternoon today, but this morning you're doing okay. And some of you hot shots think you're over here on the wellness side. Most of us, like me, sometimes I feel good, sometimes I don't feel quite so good. So I'm happy eating the donuts and the scones and so forth. Well, that's the natural flow. Everyone's on one of those lines someplace. So the issue is, I guess, where you're going. Then medicine came along and said, here are the precursors to disease. Those are the precursors to disease. High blood pressure, high cholesterol, high body weight, don't exercise, drink too much or drink more than you should probably. All the kind of thing, don't wear your safety belts. All those things are driving us towards disease. And we've known that since the 1950s. But then health promotion people came along and said, well, if those are the precursors to disease, then the opposite must be the precursors to wellness. So we spent 30 years in health promotion just being very uncreative. Precursors to disease, precursors to wellness is so-called. So precursors now, lower cholesterol, low blood pressure, low body weight, exercise, don't drink as much, don't swear, all those kind of things. Well, that last one, that's probably okay in some places.